Hi class, today I'm choosing to do my presentation on how to change a gown of a patient with an IV infusion, and sometimes the gown will become soiled. So I'm going to go over PowerPoint, and then after that I have a YouTube video to follow an example of how to do or demonstrate how to do this. That's just the title showing what it's about. Now, there's just a few things I want to point out that we should be aware of before we actually change a gown. So, of course, in the imaging department, we'll get inpatients that are hooked up to an IV and the stand and everything. And if something happens to where the IV or something happens to where their gown is soiled, hopefully not the IV, but like something happens and they need a gown change, we need to be able to know how to do that. So some things I pointed out were, one thing, we need to make sure that when we are moving the gown, we keep the fluid above the infusion site. We don't want to prevent blood backflow into the IV tube. And in order to do that, we keep it above the infusion site. And then when we are removing the arm with the IV catheter, we want to make sure we support the arm with a nice firm support so that we're not going to dislodge that IV catheter. So we don't want that to come loose or something to come undone. And we want to make sure we have a blanket to cover the patient for privacy, so as we're changing the gown. So I'm just going to go over the next few steps. So first, we want to make sure we explain how this is going to be done to the patient so they're not caught off guard. And we're going to drape that blanket over them so that as we slip the first arm out of the site that's not the affected site with the IV, we're going to take that sleeve off and we're going to remove it completely from the unaffected side, and then work ourselves over to the side with the IV in the arm. And basically we're going to remove the arm with the IV first, and then we're going to have to unhook the IV bag off of the stand and follow through to remove that bag with that arm that it's connected to, kind of like as if it's, just with the arm, we remove it all together. And we want to make sure as we're doing this that we're keeping the bag above the IV site. And then after that, we're going to right away place the clean gown while we're still holding the bag. We're going to place the bag through the gown, and then we're going to rehang that bag and then proceed with making sure we follow the arm through the clean sleeve. And then we're going to go around, and first we're going to dispose of the dirty gown so that it's out of the way of the patient. And then we're going to go around and we're going to try to finish the putting on the clean gown onto the other arm. And then after that, we're going to fasten it in the back. And then we want to make sure we document what we've done to make sure that it's in their documents that we changed part of the exam before we did our x-ray. And just here is a picture of the tech is holding the IV bag. As you can see, it's above the gown, and he's kind of placing it to where he's going to go through the clean gown and replace it. I'm going to also show a demonstration on a YouTube video as well. But if we don't want to do the whole gown change, and we don't have time or something has come up, we can do a partial gown change. So we'll basically do the same thing as we did with the complete gown change. We'll just replace the clean side with the same unaffected side first, or just over that side where the IV site is not on that arm. And we'll just drape the clean gown. We'll move that dirty gown to the other side and just drape the clean gown over the chest of the patient. That way when the nurse comes in, it's left for the nurse to change and remove it when she attends to her patient. And at least the clean gown will be draped over the patient meanwhile. So I just wanted to show this YouTube video. It's going to show a woman, either a CNA or some kind of a medical assistant, changing a gown of a patient. And I just want to make sure in the video, I want to make a note that she pauses the flow of the IV machine when she removes the bag from the IV stand. And I don't think we do this part, but I just want to point that out as probably something we would not be doing. But other than that, it looks like stuff we would be doing. So I'm just gonna put the video on real quick. It's only a few minutes long.
After performing hand hygiene and ensuring privacy, introduce yourself to the patient. Then identify him using 2 identifiers.
Hi, Mr. Mossman.
Hi,
My name is Cornisha. I'm going to help you change your gown. First, can you please give me your first and last name
Brian Mossman,
and your birthday?
8/21/59.
Okay.
Before changing a patient's gown, identify any mobility restrictions and check the gown to see if it's wet or soiled.
Okay, I'm going to raise your bed, all right?
All right.
Begin by raising the bed to a comfortable working height and lowering the side rail closest to you. Help the patient assume a comfortable supine position, maintaining his body alignment, and place a bath blanket over him. If necessary, apply clean gloves. Next, remove his gown or pajamas. If the gown has snaps, simply unsnap the sleeves and remove the gown. If the gown does not have snaps and the patient has an injured extremity, reduced mobility, or an IV line, begin removing the gown from the unaffected side first.
I'm going to put your side rail down.
Then remove the gown from the arm with the IV.
Okay. Let's take your gown off.
If an IV pump is present, pause the infusion by pressing the appropriate sensor. Remove the IV and slide the IV container and tubing through the arm of the gown.
All right. Going to get it through here.
You may begin dressing the patient in a clean gown starting with the affected side. If an IV pump is being used, repeat the same procedure. And rehang the IV container on the pole. Then restart the fluid infusion by pressing the appropriate sensor. If the IV fluids are infusing by gravity, check the flow rate and, if necessary, adjust it to the prescribed flow rate. Remember, do not disconnect the IV tubing to remove the patient's gown. Check the position and function of any other external devices, such as a brace, an indwelling urinary catheter, or a nasogastric tube. Without touching the soiled gown to your uniform, place the used gown in the linen bag.
Get your back covered up here. Go over to the other side. All right, let's get this side rail down so we can finish putting your gown on. Have you on in here. All right. Tie you on up. Close your side rail.
Make sure the bed is in the locked and low position, with at least 2 side rails raised. Remove the bath blanket, keeping the linen away from your uniform, and place it in the linen bag.
Just about done. Is there anything else I can get for you?
Be sure the patient is comfortable.
Well, if you think of anything, you can hit this red button with the white cross. We'll get you whatever you need.
Remove your gloves and perform hand hygiene.
I just wanted to go over that since we're basically already going over IV, and that's our next chapters in our patient care and in positioning. And I just wanted to make a note that as far as what the nurse did, she went over a little more than what I went over on my presentation. So I think that was a great video for us to see, and that's all I have. Thank you.